Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically anytime by using the Q&A pod located to the left of your webinar platform. You may also download a copy of today's presentation using the resources pod located directly below the Q&A pod. It is now my pleasure to introduce today's first presenter, AHA moderator Kayla Hayward. Ma'am, you may begin.
Thank you. Welcome everyone to today's webinar. This is Kayla Hayward with the American Hospital Association, and I'm pleased to introduce today's webinar, Maximizing the Impact of Community Health Needs Assessments Through Multisector Collaboration. Today's event is sponsored by Calhoun. We will begin today's webinar with the presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We like the session to be interactive, so we are looking forward to hearing your questions. If at any time you are having trouble with audio, please try refreshing your browser. You may also submit any technical questions into the Q&A box. At this time, I'd like to thank today's webinar sponsor, Calhoun. In today's webinar, we'll explore strategies for meaningful and sustainable multi-sector collaborations for CHNAs, including tactics to foster multi-sector collaboration between hospitals, health departments, and local organizations, best practices for advancing health equity and community engagement, and practical solutions for overcoming common challenges that can hinder success. At this time, I'd like to introduce you to today's speakers. Ira Chandri, Public Health Consultant at Calhoun Healthy Communities Institute. Nicole DuPont is the Director of Strategic Development at Summit Point, the Community Mental Health Authority for Calhoun County, Michigan. Irene Johnston, Executive Director of Quality, Patient Safety, Infection Prevention and Risk at Oakland Hospital. Lauren Lewandowski serves as the Community Public Health Director at the Calhoun County Public Health Department. And Dr. Stacy Shern, Community Health Advancement Project Manager with Brunson Healthcare Group. Welcome to all of our speakers. At this time, I'm pleased to turn the presentation over to our moderator for today, Ira Chandri. Welcome, Ira.
Thank you so much for the introduction, Kayla. Good morning and good afternoon, everyone. Thank you all for joining today's webinar. I'm Ira Chaudhry, and I'll be your host for this webinar. And we all are very thrilled to have you all here as we discuss maximizing the health impact of community health needs assessment through multi-sector collaboration. And before we delve into our presentation, we would love to learn more about who we are speaking to. So please respond to this poll so we can better understand where you all are in your collaboration journey. As you can see on your screen, our polling question is, how is your hospital or organization currently involved in a collaborative effort for a CHNA? We conduct our CHNA on our own through an internal process. We are part of a collaborative, but conduct our CHNA through an internal process. Option 3 is we collaborate with the external partners to complete our CHNA. And lastly, I don't know or other. And I'm going to give a second to see. I'm already seeing responses coming in. And I can see lots of people in the audience have selected we collaborate with external partners to complete our CHNA. So this is really good to know, and it is good to keep in mind as we go through our talk today. Thank you, everyone, for answering this polling question. Now let's explore the work in Calhoun County and how we have created a successful and sustainable multi-sector collaborative through a unique shared CHNA process. To give us deeper insights into Calhoun County, I'm delighted to introduce Lauren, the Community Public Health Director. Lauren, thank you so much for joining us today. Could you kick things off by giving us some background about the county and its unique characteristics?
Of course. Thank you, Era, for the warm introduction. The Calhoun County CHNA Steering Committee would also like to extend our gratitude to the American Hospital Association for the opportunity to speak with you today. Let me start by providing an overview of the demographics of Calhoun County, which is located in southwest Michigan along the I-94 corridor. The county is home to a unique blend of urban and rural communities. Its three primary cities, Battle Creek, Marshall, and Albion, serve as the central hubs where approximately 90% of the county's population resides. Surrounding these cities, there are smaller villages and towns that together make up the remainder of the population. Next, we're going to take a look at some of our key demographics in Calhoun County. In total, Calhoun County has a population of 132,849 residents, though it has been experiencing a gradual population decline over the past decade. When we examine the racial and ethnic composition of Calhoun County, around 3/4 of the population identify as white, 11% identify as Black, 7.5% identify as two or more races, 2.5% identify as Asian, 0.64% identify as American Indian or Alaskan Native, and around 6% identify as Hispanic or Latino. One of the unique parts of Calhoun County is our substantial Burmese community, and we are also home to the Nottawasapi Huron Band of the Potawatomi tribe. The gender distribution in Calhoun County is very close to an even distribution, with 50.5% of community members identifying as female and 49.5% identifying as male. The age distribution in Calhoun County aligns closely with the state of Michigan, where around 20% of the population is aged 0 to 17 years old, 58% of the population are 18 to 64 years old, and 20% are 65 years or older. Calhoun County also boasts a significant veteran population. We are home to around 8,500 veterans, which makes up a pretty significant proportion of the county's adult population. Part of this is due to the fact that we have a VA on site in Battle Creek, which is accessible to the veteran population. When we examine some of the socioeconomic factors in Calhoun County, the median household income is $60,059, which is reflective of the economic landscape in this region. The county's poverty rate is 13.2%, which is slightly lower than Michigan's statewide rate of 13.5%. Educational attainment shows that approximately 22.1% of residents have received a bachelor's degree or higher, which is somewhat lower than the state's average of 32.7%. When examining household structures, Calhoun County is comprised of 53,954 households with varying family structures and living arrangements that influence local healthcare needs, community services, and resource allocation. This overview highlights the diverse makeup of Calhoun County, which is essential when considering the health needs and challenges that the area faces.
Thank you so much, Lauren, for that overview. Now that we have some background about Calhoun County, I'll share some background about HCI and our work with this fantastic group. For those who aren't familiar with us, over the 16 years, Conduent Healthy Communities Institute has worked with hospitals, health departments, health systems, and collaboratives to implement community health platforms and has conducted hundreds of CHNAs and implementation plans. Now let's take a closer look at our ongoing partnership with Calhoun County. Our collaboration began 2017 with the launch of mycalhoun.org. and it's a customized data platform that played a key role supporting their community health needs assessment process in 2018. And this most recent CHNA marks our second time assisting Calhoun County with the full range of our consulting services. And mycalhoun.org continues as a central hub for the CHNA activities. It brings together over 250 community indicators from state, national, and local sources. So for example, the demographics Lauren just shared came directly from the My Calhoun platform. Having introduced Calhoun County and My Calhoun initiative, I'm excited to turn to Nicole, the Director of Strategic Development. Nicole, could you walk us through how Calhoun County approached its CHNAs in the past, the shift toward a more collaborative CHNA process, and how that journey led to the creation of My Calhoun website?
Yes, of course. Thank you, Era. I will do just that. So, as part of my role with the Community Mental Health Authority, I lead an entity called the Coordinating Council. This group is made up of all CEO level individuals who work in health and human services. It is this collective that laid the groundwork for the CHNA collaboration. And we always start with data. Conduent's support has actually been critical in helping us center our work. We began our relationship with Conduent in 2017, which Era just mentioned, when we were looking for a data platform that would meet our needs. But more than that, we wanted to form a partnership with an organization we could trust. Our ideal platform would have a centralized data warehouse and information system and provide the organizational structure and accessible communication style that we desired. This would help us align our health agenda, track outcomes, and identify trends. What we liked about the Conduent platform is that it brought together health indicator and demographics data in an easily accessible way, which would allow even the novice to understand it and, importantly, to be able to use it. This was empowering for both leadership and the community. We could finally agree on a single point of truth for our data, commit to working together for a common purpose, and begin collaborating on whole population health. The following year, in 2018, we sincerely began a coordinated collaboration on our CHNA. Prior to that, the two hospitals and Area Agency on Aging followed their own internal processes, which created survey redundancy and fatigue, data inconsistency, and generally no entity was rowing their boats in the same direction. And of course, this led to siloed strategies, as well as a lack of cohesion and commitment to the larger priorities identified by the CHNA. As a result, as you can imagine, the various implementation plans from each organization based on our health priorities had some impact from the entity perspective, but lacked in whole population health impact from a county-wide perspective. So the new platform was truly the impetus for our collaborative efforts and allowed us to plan strategically, manage coalition work, and build partnerships. Out of this shared point of truth, we laid the groundwork in 2018 to collaborate on the CHNA for 2019, and that collaboration was super successful. For the next CHNA, we wanted to build on that progress and also harness more expertise from the Conduent staff. So we requested the full consultation service array for CHNA 2022. This assessment was applauded as the most comprehensive to date. And once again, with Conduent support, we are finalizing our CHNA for 2025, which proves to be even better. These improvements to our assessment are apparent. With a strong base, we have been able to build upon our processes and draw upon our collective resources to gain authentic and diverse community voice and perspective.
Thank you so much, Nicole, for sharing the history of the collaboration and how it all started. It's really truly inspiring to hear how it all came together. Now let's shift our focus to the requirements for conducting a CHNA. As you all might know, not-for-profit hospitals are required to complete specific steps as part of their CHNA process every 3 years in order to meet IRS requirements. First, hospitals need to define the community service area. Next, they must assess the community's needs by gathering input from a diverse group of stakeholders, including community members, public health experts, and other key partners. And once the assessment is complete, hospitals are also required to prioritize the identified significant health needs. Finally, hospitals must share their findings with the community through the CHNA report. So now that we've covered the key requirements for conducting a CHNA, let's take a closer look at how these were applied in Calhoun County. So on this slide, you all can see the process we used to develop Calhoun County's CHNA. Like many of our clients, Calhoun operates on a fast-paced timeline requiring efficiency without compromising quality. So to meet these demands, we implemented a carefully designed phased approach strategically tailored to their needs and priorities. To start the project, or what we call the preliminary assessment phase, it included the kickoff for all the collaborative partners involved, who all were involved in the process, and also included a review of community indicators, or what we call secondary data, gathered from the national, state, and local sources. In the next phase, we focus gathering valuable insights from the community and stakeholders. And this phase involved conducting key informant interviews, hosting listening sessions with public health experts and community leaders. They all provided a critical perspective on communities' need. We also collected community voices through community surveys in English and Spanish to ensure accessibility. And recognizing, Lauren mentioned about the Burmese population. So recognizing the county's sizable Burmese population, we partnered with the Burma Center to develop and administer a survey in Burmese, ensuring inclusivity and capturing the perspective of this important community group. And lastly, in this phase, Health Department organized focus groups across Calhoun County, creating additional opportunities to gather in-depth insights directly from the residents of Calhoun County. In the next phase, after gathering all this input from the community and stakeholders, we synthesized the data into actionable insights. And these findings were then shared with the community members and leaders who collaboratively reviewed the results and prioritized Calhoun County's most pressing health needs. And in our final step, as you can see, we developed and finalized a county-wide CHNA report. Nicole, as we look back on this process, can you share some specific examples that you feel are particularly important to call out?
Sure. So first, we established the CHNA Steering Committee. This partnership is made up of Bronson Hospital, Oaklawn Hospital, the Public Health Department, and Carewell Services Southwest. This is our area agency on aging. There are 3 supporting agencies for this work. The Coordinating Council, which I represent, but I also represent Summit Point, the Community Mental Health Authority. Population Health Alliance, which is our issue action group entity. And the effort is organized by Conduent, who helps set agendas, meetings, and lends expertise to us as decisions are being made. We have been meeting in May of each year prior to the CHNA report release, which occurs around December. At initial meetings, we review the survey questions, determine if we will use focus groups, listening sessions, and or key informant interviews. And we also create our timeline. Over the next several months, while Conduent is analyzing our secondary data, the committee members go out and collect community voice. Both the primary and secondary data are to be completed and analyzed by September, which is when we then share that at 2 public prioritization sessions in early October. Once the priorities have been voted on, we then begin writing the report. The reporting timeline for the hospitals and the AAA are different. Oak Lawn needed the report to go to their board earlier than Bronson. So Bronson figured out a way they could participate in our county report timeline by staggering their work for the other counties they served. The AAA derived a senior-focused report from the CHNA that met their needs, and the health department continues to align this assessment with their community health improvement plan. And then, of course, at the CMH, we use this report to inform our overall strategies for the community.
Thank you, Nicole. It's great to hear how your partners have tailored their work to align with their timelines. And in our experience, collaborative often need to be flexible and navigate between the timelines in order to work together effectively. Now, I'd like to turn it over to Stacy, the Community Health Advance Project Manager of Bronson Healthcare Group, and Irene, the Executive Director at Oak Lawn Hospital. Stacy and Irene, you've just heard Nicole discuss how both Oak Lawn and Bronson have contributed to the shared CHNA process. So, for you both, the question is, from a healthcare perspective, can you each share some effective strategies you've used to foster collaboration with other organizations or sectors? And Stacy, let's start with you.
Thank you, Era. I appreciate the question. So a great deal of my role as the project manager involves collaboration. So when considering collaboration, it's first to really identify the why behind that particular collaboration. So a few questions that you may want to consider is, one, is there a need for that collaboration and is it necessary? You can ask yourself whether you can accomplish everything on your own or if you need others involved in that process. And then second, will the collaboration help you attain that end goal? So going into every project, I typically have a clear vision of my end goal. I often ask myself, will others help me reach that goal? But more importantly, I consider how they can enhance and support my efforts and how they can help move me from point A to point Z. And then third, are there others who share that same common goal or interest? So are there other individuals or organizations doing similar work that you can involve in your efforts? And I will say that typically collaborations are developed because there is a shared interest or a common goal between that group or individuals. In this case of our collaborative approach that we took to develop our CHNA, each organization had a common interest, and that was to determine the health needs of the community. So we understood that through our collaboration, we could, one, learn from one another. We could also generate a plethora of ideas, and then also we could problem solve together. So we also understood that for us to see a change in the health of our community, it would take each of us working together to create that change.
Thank you, Stacy. I completely agree with those thoughts, and I'd like to add a couple of thoughts as well. One, there was, when folks registered, there was a question that came in that was posed as to how to find the right size for the advisory committee. And this answer will best be answered by those forming the committee. In our experience, we ensured there was at least one representative from or someone who could speak on behalf of the nonprofit organizations functioning within the county. So this will be a one size fits all or most. There isn't a right or wrong answer. It's what works best for you. And then as Era reviewed earlier, there are general requirements to conduct a CHNA. It is acceptable to complete a CHNA as an individual, organization, or as a collaborative. The collaborative approach is not a necessity to complete a CHNA. However, this is just the second CHNA process I've personally been involved in, and all I know is the collaborative approach. While I now understand community partners collaborating to complete an extensive and inclusive community health needs assessment is not commonly used, I can't imagine being able to perform the level of assessment that we have without our collaboration. For me, it's important that my organization and colleagues on the collaborative, that the CHNA is thoroughly completed with meaning and actionable goals identified. We are all committed to ensure that we help make a positive difference in the community we serve and use each of our own organizational strengths and outreach to support the community where we can. By working as a collaborative, we can reach more individuals and bring more value to the process and document than just checking a box for tax exemptions. I would also like to add, as with all things in healthcare, we look for ways to continually improve. So the same is true with our CHNA collaboration and committee. In the coming year, we are planning to continue to meet at regular intervals to discuss each of our goals and interventions from the CHNA process. We will be sharing barriers as well as successes and continue to find opportunities to collaborate for the betterment of our community. So thank you for the question, Era.
Thank you for sharing those effective collaboration strategies, Irene and Stacy. Since I started working with you all in 2021, I've been just impressed by how you all work together and your strong commitment to equity, making sure all voices are represented and heard throughout this your CHNA process. So it's a commendable work. Speaking of equity, this slide highlights Conduent's approach to promote health equity, which focuses on examining disparities in the data, analyzing social determinants of health, integrating data for a more comprehensive understanding of barriers, and fostering community engagement and multi-sector collaboration. And since we are talking about equity, it's important to highlight some of the best practices adopted by Calhoun collaborative partners. Lauren, from your perspective, what do you believe are the most effective strategies for promoting health equity and fostering community engagement, particularly when working with the historically underserved populations?
Thanks for the question, Era. Having equity and inclusion at the forefront of this process was important to all members of our collaborative. Giving folks the opportunity to share their experiences and have their voices heard is powerful, especially in underrepresented communities who are too often ignored. I also want to emphasize that this is work that can't just happen during your CHNA process. Engagement and empowering underrepresented communities to share their voices and feedback should be and needs to be a part of our everyday practice. Building that trust is crucial in successfully engaging community members during your CHNA cycle to get their voices heard. There are various strategies that our collaborative utilized to ensure that we had equitable access and increased community engagement. The paper surveys were available in Burmese, Spanish, and English and placed at our local Burmese and Hispanic Latino community advocacy organizations. Through existing partnerships with the Burma Center and VOSIS, health department staff were able to work directly with community members on the completion of surveys at different community events and during outreach efforts. During these outreach efforts and at community events, staff members who speak Burmese and Spanish were able to help the community members facilitate the completion of the surveys, which built further trust with our community members and addressed language accessibility as well. Additionally, the collaborative partnered with numerous organizations to have paper surveys on site to increase accessibility. The hospital systems, Bronson and Oakland, and the public health department had surveys available at check-in desks and QR codes for the online surveys on various screens within their offices. The local CMH Summit Point also played a role in survey distribution. In addition to providing paper copies to clients and staff, they provided funds to purchase gift card incentives. These were given to community members to compensate them for their time in completing the survey, because we know it took about 20 to 30 minutes for them, and it demonstrated that we respected both their time and their input during the process. When preparing for the focus groups and identifying underrepresented groups, our team of epidemiologists examined health disparity data and previous CHNA's data to determine where outreach really needed to be focused, bringing a level of community voice to the process from the start. Their review found that engaging communities of color, individuals experiencing homelessness, and those facing food insecurity would bring representation to some of Calhoun's most marginalized communities. The focus groups were held at locations throughout the county where trust among community members was already built. Finally, during the completion of the focus groups, staff members who spoke Burmese and Spanish were trained in facilitation and led focus groups in community members' primary language. These efforts highlight the importance of proactive engagement and the value of partnering with trusted local organizations to reach marginalized communities. By including language access, cultural sensitivity, and ongoing community trust building into our CHNA process, we were able to gather more representative data and engage our marginalized populations.
Thank you, Lauren, for sharing these strategies. Now that we've discussed ways to engage the community in the CHNA process, let's try to shift the conversation to some of the common challenges and barriers to collaboration. I'd like to start by sharing our own experience. We found that communication and trust are often the two most frequent challenges. When it comes to communication, many organizations use different terminology, data sets, or have distinct organizational cultures. And that can make it difficult to align efforts early in the process. Trust is also another critical factor in these collaborative efforts. Sometimes it requires rebuilding due to past experiences, while in other cases, new relationships must be formed to create a strong foundation for collaboration. Lauren, in your experience, what have been some of the key challenges and barriers to cross-sector collaboration?
Yeah, building on what Era mentioned, we experienced a lot of what she previously mentioned. One of the biggest challenges for our group was that for half of the committee members, this was their first time ever participating in a CHNA cycle in Calhoun County. As you can imagine, learning the process while simultaneously engaging in it can prove to be quite challenging. There's a steep learning curve when it comes to understanding the complexities of a community health needs assessment and the community engagement components, all while trying to move the project forward. Additionally, many of our committee members hold multiple responsibilities within their organizations. This means that finding dedicated time to focus on the CHNA process while also balancing their other job duties was a constant struggle. It's difficult to prioritize a project as significant as the CHNA when there are many different competing obligations. Another historical challenge we've faced is that the CHNA collaborative typically only meets during the assessment process itself. While this allows us to gather key stakeholders during that time, it does limit the opportunity for trust building and relationship development between partners. Without regular engagement, it's difficult to maintain the momentum and continuity for necessary effective collaboration. This intermittent interaction also leads to a time crunch when it comes to completing all of the necessary tasks within the designated timeline. There's a sense of urgency in the final stages of the process, which can affect the quality and thoroughness of our work.
Thank you, Lauren. I'm sure many of you in the audience can relate to these challenges and barriers. Now, given the success that Stacy, Irene, and Nicole have had in overcoming these challenges, I'd like to turn the conversation to practical solutions. What strategies would you recommend for fostering alignment and building trust among diverse stakeholders? Stacy, let's begin with you.
Thanks again, Era. So practical solutions to improve alignment can include ensuring that there is a common agenda or goal among stakeholders. And this ensures that everyone is aligned as they work toward that goal that they've set. It also helps stakeholders see their goal clearly as well as where they're headed. And I would also say that identifying expectations among stakeholders. So this involves clearly outlining those expectations for not only the group, but also each member. And this can boost the group's engagement as well as their productivity. And also ensure there is a consensus in decision making. And in some cases, group members, they may not agree all the time. There will be some disagreement. So the goal is to arrive at a place where everyone may not fully agree. However, everyone can support the final decision. And then lastly, I would just say to build trust, just provide a safe space to share, keeping in mind that there will be different viewpoints offered throughout this process.
Thank you, Stacy. I agree with that. The mindset is very much important. Developing, I think also what could help build the trust and consistency is developing an orientation or collaboration guide to help new members joining the group feel included. And it helps them then feel up to speed on the group's goals and expectations while they're learning and moving it forward, similar to what was mentioned earlier. Something else that does work well to help build a strong and trusting working relationship between organizations that don't typically work together in the same space, and they may not even see, or they may see each other as competitors. It's helpful to have a standing initial agenda topic that allows each group member, maybe 30 seconds or less, each to introduce themselves, including their role, and answer maybe an icebreaker question just for the first few meetings. This is particularly important if meetings are virtual, as there's not a lot of that typical pre and post meeting mingling that can occur when the meetings are in person. Once the team's more established, it might not be something necessary to continue, but that does also help build that working relationship and trust is what I have found. Nicole, do you have any thoughts?
Yeah, those are some great points, Irene and Stacy. I just want to add, as I mentioned before, having a single point of truth for data is really key, along with having a coordinating and unifying organization like Conduit to help organize the work, but also to help keep moving things forward. The hospitals committing to a collaborative effort is critical. Here in Calhoun County, they represent both sides of our county, making it a whole. So it's really important to have that dual perspective. And then, as Lauren touched on, giving staff the time and space to collaborate is so very important. It's challenging work, and it is already on top of their full-time jobs. And then, as Stacy mentioned, it's important to work together when mapping out roles and responsibilities, but you also need to be honest about what works and what doesn't, and provide consistent communication. I also think having a unified branding and communications plan is important so that the community can see how we're aligned and committed to their health and their voice. Finally, I would say plan on at least an 8-month process from start to finish. But I'll tell you, we have done this for several years, and it still feels super rushed when the clock starts ticking. As an aside, as Irene touched on, this year we have determined that we need to meet at least quarterly over the next 2 years to make sure we are tracking progress together and aligning our implementation efforts. So those would be my thoughts for that. Thank you.
Thank you, Nicole, Stacy, Irene, and Lauren for sharing your valuable insights. I've seen lots of thumbs up coming when you guys were talking about strategies. Thank you, everybody, for your positive reactions. We are truly grateful that Conduit HCI could play a role in supporting this collaboration through My Calhoun platform. And it's been an honor to help facilitate conversations that not only deepen our understanding of community experiences, but also strengthen the trust among all of your partners. So thank you so much. And as we wrap up our discussion, it's clear that cross-sector collaboration in community health needs assessment process offers a valuable opportunity to leverage the strength of diverse organizations. While challenges are natural part of this work, today's insights have demonstrated how each organization's unique perspective supplements the process. And finding common ground on a shared goals is essential for aligning priorities and ensuring meaningful progress. Lastly, but not the least, while sustaining engagement over time can be challenging, as you heard, today's conversation shows that we can lay the groundwork for lasting improvements in the community with a collective commitment to these goals. Thank you all for being part of today's conversation. Thank you so much, audience, for listening to us. I'll now turn it back over to Kayla to address any questions that may have come up now. Kayla?
Thank you so much, Era. Yes, so we'll now begin the Q&A portion of today's event. As a reminder, you may submit a question for our speakers in the Q&A box to the left of the presentation on your screen. Our speakers will answer as many questions as possible in the time remaining. Any questions that are unable to be answered in our allotted time will be shared with speakers for follow-up offline. And so at this time, we'll get started with the first question for our panelists. Can you share how local communities are partnering with states on their respective plans and how they're working collaboratively amid shared or differing goals? Lauren or Ira, would you like to answer this?
Sure, I can go first, and Lauren, you can piggyback. From our perspective, local communities and states increasingly find ways to align their efforts and work collaboratively, even when sometimes their goals differ. So for local communities, they bring valuable on-the-ground insights about specific needs and populations, while states generally provide broader resources and policy guidance. So successful partnerships often involved identifying overlapping goals. So for example, reducing chronic disease or addressing health equity, and leveraging each entity's strength in these overlapping goals. And when, of course, the goals differ, collaboration focuses on identifying points of alignment or creating a complementary strategies during hospitals' implementation plans or health departments' community health improvement plans. So, for instance, a state might prioritize reducing obesity at a population level, but a local community targets can be access to healthy foods in underserved areas. So by aligning these efforts, the community can focus on actionable, localized initiatives, contributing to the state's broader objectives.
Yeah, and to build a little bit on what Era had mentioned, a lot of times the state health departments will have different initiatives and work plans that they're working on, and they have their own individual needs assessments for different priority areas. Here in Michigan, we have a needs assessment that the state completes that's focused on maternal infant health. So what different collaboratives can do is they can take a look at what the state has implemented for that needs assessment, and they can align their questions with that to allow for further comparison of the data and breakdown of the data. Locally in Southwest Michigan, we also have a perinatal quality improvement collaborative that has been exploring different ways in which the different health departments in Southwest Michigan could potentially align questions about maternal and infant health so that we can all compare across the board. And so it's kind of contingent on where the state has their different processes for different health needs assessments on their level.
Great. Thank you both. I'll move to the next question coming in. How would you encourage diversity in the selection of nonprofit organizations and community-based groups? It seems like we continue to rely on the same partners, and since these partners focus on specific themes and/or age groups, that a good chunk of the needs of the community are repeatedly missed or not met.
Hey, if you don't mind, I'll take that one. Is that okay? All right,
Sure.
thanks. Okay, so that is such a great question. So it is true that we rely on certain partners to speak to the needs of their community. So for example, we've already discussed the Burma Center being kind of our place where we hope to get the voice of the Burmese. We also have Voces, which speaks to our Latinx populations, and a myriad of other agencies, because we know that they truly have the pulse on their concerns. However, we also seek to broaden the scope of our community partnerships to better capture the voices and experiences of diverse populations by actively identifying underserved populations or overlooked areas. We do this by expanding beyond our traditional partners, looking for unique partners, engaging emerging grassroots organizations, and leveraging networks and coalitions. Let me think. So an example of this for this year was when the health department shared that the Congolese were utilizing their services more, and they actually had not been in our radar previously. So we sought representation from that community and began forging a relationship. Other examples are, there's an organization called Milk Like Mine. It's a newish nonprofit focused on women of color. We accessed Catching the Dream Learning Center, which serves Burmese families. So even though we use the Burma Center, we try to get more representation from the Burmese from speaking to the families themselves. And we worked with several churches in key communities, which we had not done previously. We were also able to get great information by having the survey given out at back-to-school events across the entire county. And we had so many amazing responses. And that is because we exchanged them for gift cards. And that is effective. And I would use that if I were you. Does that help? Okay.
Yes, thank you so much, Nicole. Thank you. Next question. With the climate of mistrust in the healthcare system, how do you overcome that barrier? With the change in the political climate, do you see this going to be an even bigger struggle?
This is a great question. Is it okay if I take it?
Yes,
start.
go ahead.
All right. So thank you. Let's see. Our collaborative did face the challenge of finding everyone's voice related to both lack of understanding or healthcare literacy, as well as the mistrust in healthcare. I think Lauren and Nicole have done a good job throughout the presentation, kind of explaining some of the ways we did try to build those relationships and gain that trust. So we used our partner relationships to reach out to those minority groups and meet them where they live, meet them where they were at, using interpreters on site to maintain the language and build the trust, to solicit their input and help convey that we found their voices important. As for our country's political climate, the changes we may face, this is just a known unknown. I don't have an answer for that. I know it's going to take flexibility and awareness to continue to change and move with the current. That's my best advice there. Stacy, would you have anything to add?
Absolutely, Irene. So thank you. I will definitely say that there is a climate of mistrust in the healthcare system. So Bronson serves 3 counties across Southwest Michigan. Calhoun County is just one of those. And the other 2 are Kalamazoo County as well as Van Buren County. So mistrust, it was identified actually in all 3 of our 2022 CHNAs. And just to give you an example of how healthcare systems can overcome this barrier, and that is by creating opportunities for community feedback. And I would say one approach that you could use to gather that community feedback is through community conversations. And this is actually just a form of engagement that brings people together to discuss important issues. And just to give you an example of what we did at Bronson. So this summer, Bronson in collaboration with Kalamazoo Youth Development Network, we hosted a community conversation titled Restoring Community Trust with Healthcare, an intergenerational conversation. And the aim of this event was really just to initiate that healing of the relationship between the community and the healthcare system. We featured panelists that consisted of community members, which were youth. So when you're thinking about, how to engage community, it's just not us as an adults, but also incorporating that youth voice. And then also on our panel, we had healthcare professionals. And we just provided an opportunity for our community to ask questions and to participate in discussion about building that trust and fostering healing as a community. I will say that this conversation will not end. We do plan to meet again in the spring, and we will also be replicating what we did in Kalamazoo in Calhoun County as well. So I would just suggest, if you plan to use this approach, just don't make it a one-time thing. Just continue to engage your community for feedback. Thank you.
Great, thank you both. Let's see, how do you set meaningful, measurable goals with overlapping and complex issues like food security and mental health with strategies like care coordination and resource access?
Okay, I'm going to jump in and take this one because I heard my buzzword mental health. Okay. All right. So that is also another really great question. So when addressing overlapping and complex issues like food security and mental health through strategies such as care coordination and resource access, it's essential to set clear, measurable, and realistic goals that are grounded in the realities of the community. The goals should be flexible enough to adapt over time and incorporate diverse stakeholder input to ensure they remain relevant and impactful. Here, we start by using a holistic and integrated approach. It's essential to recognize the interconnectedness of these issues and develop goals that reflect both the specific challenges and the broader systemic factors at play. First, you need to see the interconnectedness. And in this case, that those with mental health issues may have difficulty accessing food resources. Then you have to identify linkages and address needs collaboratively instead of doing that in isolation. We also make sure to gather data and we like to do that to better understand the specific needs and barriers in the community, but also what assets we have. We do deliberately create SMARTY goals in our issue action groups. So they have to be specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. And these goals have joint outcome measures that with our partners. So we include our partners in this work. I would say a good example of this would be, so let's see here, by by the end of the year, we will improve food security and mental health outcomes for 200 low-income individuals by implementing an integrated care coordination system that connects them to both food resources and mental health services. So for this goal, it's likely that we at the CMH would take the lead. We would coordinate the efforts and track the success in our community issue action groups, which is what I mentioned earlier. And I think that it's through measuring both individual outcomes and system level improvements that you can create a more integrated and effective approach to addressing these intertwined challenges that you just asked about. So I think that's a good start there.
Thank you, Nicole. All right, a couple more questions. Can you speak to successful strategies in moving from quantitative data analysis to qualitative assessments? And
Well,
I'll direct this to Ira.
yeah, Kayla. Hearing quantitative and qualitative, my brain is just, okay, this is my question. Okay, so moving from quantitative to qualitative assessment in the context of community health needs assessment involves strategically complementing the data-driven insights with the community voices and lived experiences. So how we do that in our process, I mentioned in while talking about the process of Calhoun County CHNA, first thing we do is the secondary data analysis, which is also called quantitative data analysis. And in that analysis is basically learning what are the trends already going on in the Calhoun County. Where are the health disparities? Where are the disparities in the zip codes in Calhoun County? To learn more where we can pinpoint key gaps in Calhoun County, what populations are the ones we need to reach out. So by leveraging our secondary data analysis or quantitative data analysis, we focus on identifying qualitative assessments. We try to find out what are the key partners from those vulnerable populations that can tell us more about the problems that are going on in the community. We also have our platform also have mental health index. We also have health equity index and food insecurity index. And these indices basically also help us to look into these zip code disparities. And that helped the collaborative actually to market the community survey to those specific areas where there is high needs. So I hope I answered the question, how we leverage the quantitative data and put it into qualitative data.
Yes, great. Thank you, Ira. And I think we have time for one more question here. How much were Burmese surveys utilized, and were there any challenges with offering the CHNA survey in other languages? Did you need a native speaker to assist residents taking the survey in another language other than English?
Take that one. The Burmese surveys were highly utilized. One of the things that we found during this process, and I think it's important to go into a CHNA process with the mentality of, I do not know best, my community knows best. And so one of the things that we have a couple of Burmese staff members here at CCPHD. One of the first things I asked them is, in what way would it be most effective to deliver the survey to the Burmese community? Are they going to prefer it electronically? Do they want a paper survey? Sometimes folks prefer receiving information auditorily versus having to read it and digest it. And so having our health educators who are able to speak Burmese were crucial in obtaining the Burmese voice through this process. We were, again, really fortunate to have Burmese staff members who are trained interpreters, and they were able to facilitate that. So that kind of closed the gap in achieving the Burmese voice. So we didn't run into any barriers with that. But overall, yes, I would highly recommend having a native speaker being able to interpret that into community members' primary language. And it also just, again, demonstrates that cultural sensitivity and respect.
Great. Thank you so much, Lauren. And that does conclude the time we have today for questions. I'd like to thank our moderator, Ira, and our wonderful panel for their time and excellent presentation today. And thank you again to our sponsor, Conduent. To learn more about the content presented today, please visit the resource section on your webinar console and complete the post-webinar survey. In the next few days, all attendees will receive an email that will include a link to the archived webinar session. Thank you again for joining us today. Have a great day.
That concludes today's teleconference. Thank you for your participation. You may now disconnect.